exercise of to manage this patient, because we have seen so many varieties of cases over the 45 years. Many challenging cases I have done. So I knew that after, even though from outside it looks inoperable, sometimes the main thing is I have to make a cut and take out the valve and put in a valve. So from our experience, we know when we see the aorta, feel with your finger, I know which patient I can cut and the stitch will hold. So with that only I proceeded with the operation. I remember way back in the 80s, 81, when I was studying for MCH, we opened like a young patient like that. We couldn't do anything. We just closed and told them it is nothing can be done. And he didn't live that long. So I have seen it before, some cases, and also sometimes we operated, it may not be that. So it is a matter of experience only. The more you see, the more you know. It's something on the sixth sense, I would say. Because another person may feel that nothing can be done, but an experienced person definitely will be able to tackle a complex case. So that is why he was referred here. They know that we are doing all this in SIMS. It is made in India only. Chitra valve, TTK Chitra valve. That valve will last for life. It will outlive the patient. Only problem is you have to take breath-thinning tablet throughout life. That is the disadvantage of a mechanical valve. Now, other alternative, if the surgery is not possible, we can put a tissue valve by TAVR, we call. Without operation, we do valves. But in a young patient, if you put a TAVR, it will not last more than 6 or 7 years, sometimes maximum 8 years. That also was not possible, because if it is truly inoperable, only alternative is put a TAVR. So that is a big disadvantage for him. And it could not be done technically because of the rocky calcium sitting inside. Yeah, he is going home. Yes, normally in another once the bone healing will take about 6 weeks. So after 6 weeks, you will be able to do all normal. Now itself is normal. He's walking around, he can climb stairs. The tolerance to physical activity will become normal in 2 months.
I have a dizziness feeling during playing. Where I consulted our hospital. After further review, they told to replace the valve, and on the day of surgery, they postponed it and told that it's risk to do the procedure, and they forward to Bashi sir. Problem was shortness of breath during walking. For the past 6 months, it's difficult to walk more than 50 meters. That's my issues. After surgery, it's feeling good. Everything is coming back to normal. Now I completed my post graduation. Now I'm preparing for state exams in Kerala. The problem is shortness of breath during doing some work or climbing stairs. That's the main problem I have. Started in 2022. That time when I do heavy work like running for some, that only gradually over the years, the problem increases.
heart valve disease, the thing is, people are very scared of operations. When you say surgery, means everybody. A lot of people, I know, who are even. I had a patient last month. I advised an operation 3 years ago. So they were scared. Come back in end stage heart failure. That time nothing can be done. Now, about 45, 46 years ago, when I joined heart surgery, the risk of heart surgery was, maybe 15%. Some problem used to have negative results, that in spite of good operations. Now, things have changed. Those days, a patient surviving after operation was a very big news. Today, a patient dying a heart operation is a big news. That much technology has developed and experience of the surgeons all over India. See what is available anywhere in the world is available in this hospital. We have all the facilities, whatever related to the heart, anything we can do. We have the technology, the manpower, and the infrastructure, and we have the experience to do it. So it is very difficult to convince the people. They think, what happens also, social media, YouTube, and all people will spread the wrong information. Nobody will tell something right. Everybody is a doctor. You understand? When olden days, if I suggest a treatment, patient will listen to me. Today, patient suggests a treatment. Doctor, I want this. So I have to listen to the patient. That is where I am treating. First I asked, what do you want to tell me? First I said, these are the things. Then he said, sir, can we do this way, that way, so many things they will ask. And usually they come with a cell phone, with the iPhone, all the questions. So I find more strenuous and painstaking explaining the patient and the relatives about the operation, because doing the operation is my job. Operation theatre, nobody to disturb when I am there. I do the operation. I have no stress at all. You understand? That is my job. But the explaining is the most difficult. I don't mind talking, but the person who asks the questions to me, they may not be knowing anything about the heart. Still, they ask questions. If I answer the question scientifically, they will not understand a word of what I am talking. Because even after spending 55 years studying medicine, I'm still learning every day. That is our medicine. We are not touched the tip of the iceberg still. So, of course, some knowledge is good, which is public have a lot of knowledge, but misinformation is more. People try to frighten others. They will only show a negative result. About 1,000 patients would have successfully gone. 2 or 3 patients would have died. They only talk about the negative thing. So that is the biggest disease I find today.